Good afternoon again, everyone, and welcome again to this webinar on how to improve adoption, utilization, and satisfaction through marketing. I'm your host, Stephen Dean, the COO of Kiona Health, and I'm very pleased to have our special guest, Bill Hambsh, with us today. He is, as you can see on your slides, the screens, the CEO of North Florida Women's Care in Tallahassee. Beyond this, he has a depth of experience in management. He's on the board of MGMA, which I'm sure most of you are familiar with. But not only that, he brings extensive background with management and operations. He's formerly with ACOG, ambulatory practice operations, as well as he is still a fellow with the ACMPE, which is the American College of Medical Practice Executives. So he brings to this topic a depth of experience, and it is our very great privilege to have you, Bill, share your deep experiences with us today. And with that, I'll hand it over to you.
Thank you, Stephen. Hello, everyone. Can you all hear me? It is my pleasure to be presenting today's program with you. I have been with my practice for 19 years and have definitely evolved in my marketing strategies over time. I am sure you agree that we all wear many hats in our roles. Marketing is typically handled by us unless you are fortunate enough to budget a public relations staff member or outsource this to an outside vendor. We are going to cover a lot of ground today. My hope is that you don't feel overwhelmed and take each task as individual goals that you accomplish over time. I've included several checklists to help you gather your ideas and set a plan in motion. I want to give a quick plug to MGMA before I get deep in the discussion. MGMA stands for Medical Group Management Association. I am on the national board and represent 33,000 members nationwide. Most of my medical management education came through the resources made available through this association. We are part of better performing practices because of the knowledge made available to me through MGMA. Now, back to the topic at hand. Let me say a few words about my practice to give you more background on who we are. As you can see, we have 13 providers, including 10 physicians and 3 nurse practitioners. Our panel has a wide range of popularity. Some patients want a female, some want a male. Some want to see a seasoned physician, and some just want to get in and don't care who they're with. It is important to realize that patients do have preferences, and you should consider this in your marketing program. We have one main office location in Tallahassee. However, many patients come from a 70-mile radius in many rural markets around the area. We also send a physician with staff once a month to a satellite clinic along the Gulf Coast down in Carabel. Different clientele, but still of value. There is a shortage of doctors in the area, so it is important that we reach the population in these rural markets. As you can see from this breakdown, over 90% of our patient demographic is under 65 years old, and they probably use a smart technology on a daily basis. They probably don't read a real newspaper. Adapting your marketing to your demographic is key to spending money smartly. Now, whether they use computers and share their email accounts, that is a different story. But capturing emails are critical to patient communication. We explain to patients what we do and what we don't do with their email, and it is usually not a problem. Today, patient portals are becoming mandated by the government. How practices use them varies with every color of the rainbow. Find out what is important to your practice, develop a program that meets their needs. Medical practices primarily focus on patient care in medical terms, but spend little time outside of this comfort zone. Once the patient leaves the office, little is done to connect with them afterward. There is a missed opportunity to build stronger relationships with the patients beyond the exam room. Your providers are subject matter experts and usually have the best answers patients are looking for. However, patients go online to Google and search. Many things they find online are not credible sources. Being the source for your patients helps build loyalty and increases your branding throughout the community. We serve women, and women have different educational needs at different cycles of life. Take advantage of this and share your knowledge. Be the leader in the community people turn to when they need to learn and get advice. Zika virus is all over the news right now. What are your patients doing for information? This is one of my favorite slides and one that is very important to do immediately and often. Patients have choices as to who will provide their care. They are going to research in many different ways, such as talking with their friends and family, talking with other medical professionals, or even surf the net. Your homework assignment is to develop what I call a value portfolio of your practice. These are the qualities and characteristics that may make you stand out. Ask yourself, why would someone want to come to your practice over some other provider in town? Do you offer a unique service? Do your providers use special technology? We have handheld ultrasound machines that can be used quickly during a routine prenatal visit and give mom some reassurance that baby is okay. Do you have options for patients to request appointments or talk with a clinical person through the patient portal? Is it reliable? We live in a microwave society. People want instant response. Gone are the days that the expectation to respond to an email is 24 hours. Today, it is more like 3 hours. Go through every aspect of your practice and identify characteristics that make you stand out. This is your outline to use when developing your marketing plan. This slide is fun and it shows a comparison of old school tools that have been replaced by modern technology and applications. It wasn't long ago I had a Rolodex on my desk, and today I have a phone that tells me whose birthday it is and which of my friends have a new job. It's almost impossible to stay hip because our world online is changing faster than we can comprehend. I still don't know what Pokemon Go is, but everyone around me is doing it. So why don't you do marketing? Well, myth number one is a real life statement I heard from one of my doctors 19 years ago. Someone may have a real beautiful building, but I bet there was more thought behind the patient's decision to walk through that door than what an amazing glass entryway the building offers. The reality is that our world is much more sophisticated than that. We used to pay lots of money to have the biggest ad in the yellow pages. I don't spend a dime on that anymore. Ask your staff even if they know where a phone book is. Is it worth the money you spend? How do you know if your patients even use this to choose? Most practice management systems offer a method to track how you capture your new patients. What referral sources do you have built in yours? Health fairs? Radio ads? Get as detailed as possible. Our top 3 resources are friends and family, referring physician, and the internet. Yellow Pages was less than 1%, and yet I was spending $25,000 a year for advertising. There are other reasons why doctors refuse to spend money or time on marketing efforts. It's too expensive or complicated. I can't keep up. No one uses the portal to communicate with me. I am here as a mythbuster, and I will confidently tell you that none of these statements are real. There are people on your staff or from your patient population that offer resources to you that you can tap for little or no money. Buy them a lunch to thank them for their help. Food goes a long way in our office. There are so many great, easy, and low-cost programs online that make this easy to accomplish. Marketing is as much about listening as it is branding. And patients will tell you about changes you need to make. Back in January, we had a huge problem with clerical staff quitting. I had found that millennials do things as a group. It's not good when one of them is upset. Patients were complaining about the wait time to get through on our phone system. I sent an e-blast out to patients offering relief by utilizing our portal to do most of the things they called us for. It was important to me that they were rewarded with fast turnaround time. By marketing this, I changed their behavior and saw a spike in utilization online. But one e-blast won't cut it. Constant communication with patients is key to the mission. Those patients who choose to leave a voicemail may have been called back 2 to 3 days later, which was a missed opportunity to provide services and increase revenue for the practice. You do need buy-in from the entire staff to make it work. Solicit feedback from them too, as they are in the trenches with the daily task and will help you work through these campaigns and projects. We are not perfect and won't always get it right the first time. Be brave to admit failure and listen to what needs to be improved. Have you ever been sitting in a room, say at a work meeting or at the doctor's office, and you yawn or sneeze, and suddenly everyone around you in the room is yawning or sneezing? Well, the same can be said with activity online, such as a Facebook post. If someone likes a post your practice puts online, they will share it with their friends, who will share it with their friends. This is the sneeze principle. Your one post spread everywhere and built more awareness about you than you probably expected. If you remember the mother who bought a Chewbacca mask from Kohl's and posted a video of her wearing the mask in her car and laughing the entire time, she was an overnight celebrity. Social media has such great power that many people do not appreciate or expect. Okay, now we're going to get our sleeves rolled up and get deeper in the program. It's time to sharpen your pencils, but do not worry. There are several checklists available throughout this presentation. You'll be provided a copy of this presentation afterwards, so do not worry. I am a goal-oriented person, and I suspect many of you are too. Start with developing some goals for your marketing program that you would like to achieve and measure them throughout your campaign. This will give you feedback on how you are doing. We first turned on our portal back in 2008, and today we have over 25,000 registered portal users. But even more important than that, how many portal users are actively using the features online? Do you have a way to track how many patients are requesting appointments or sending clinical communications to providers? Do you have a high volume of prescription refill requests? Perhaps they are calling for tests or lab results. How quickly are your staff responding to patients online? How long does it take for a patient to get a return phone call? My expectation is no more than 6 hours for a return voicemail. At the end of the day, what results or outcomes do you want to see? These are just a few goals that you can create for your practice. Develop them and know how to measure them, and then analyze them. But Bill, where do I start? What do I need? Well, this checklist is a great starting point. Take time to recruit, gather, and develop these items. Just about everyone can write something, but does their writing match the culture and professional brand you want to portray? Be careful in selecting the right people, and they may not even be on your staff. Patients can also be a great resource. It is important to have enough content to keep your communication fresh. One blog post you wrote in 2011 about the H1N1 flu doesn't qualify as a good program. Grab several folks that can be a resource. Find out from your clinical staff the topics that patients most often ask about. In my office, menopause is a hot topic. Women can't get enough of this topic, and it is always well received. Or perhaps many folks are having difficulty conceiving. We also developed what clinical screenings are needed for different age groups. Mammograms are not always medically necessary to a young woman, whereas STD screening might. Develop these for patients to reference and then talk about them. Graphics are important too. No one wants to read anymore. We are busy watching videos or listening to books on iTunes. Graphics help attract your audience. There are many more tips here to use, but we must move on. Here is a great example of how graphics can attract the user. This is an OBGYN practice I found in Texas several years ago that showed a picture of triplets from one of their patients. Pretty smart in that they not only captured the audience with the picture, but also sent a message that, hey, we can handle complicated pregnancies. Developing a Facebook page is quick, easy, and free. This image shows how that practice incorporated a blog post on their Facebook page, all the while marketing a unique service they provided a patient. Basically, the dad was an active duty military member in South Korea and wanted to be part of the delivery. The hospital permitted him to connect via Skype so that he could be part of one of the most important memories of his life, the birth of his child. And as it showed the practices also support of the troops on Memorial Day. Very creative and totally free advertising. There are many things a business can use Facebook for, but it is also important to develop a strategy. How often are you going to post? What are the best times to post? What pictures do you want to post, and what events are you trying to promote? Just to name a few. So the danger of Facebook is that it's extremely easy to use, and this cartoon shows a patient reading a post of his doctor posted online. Basically, it says, first day off in 2 weeks, gonna get hammered. Be careful what you post and who you friend. I even recommend physicians have 2 Facebook accounts. The first is for their friends and family, and the other is to use professionally if you do want to friend patients. Be warned that patients can abuse this, so set the expectations up front. Next is Twitter. I have a Twitter account, but not as active with this as I am with Facebook. But Twitter provides networking opportunities not possible through sites that restrict you to likes and networks. Twitter provides instant potential to go global. This is the best way to connect with influential or key people. You are limited to 140 characters, and I would not recommend the same content that you put on Facebook that you use on Twitter. But the hashtag allows users to connect with other folks across the globe. Then that takes us to LinkedIn. I would recommend creating a professional LinkedIn page for each of your providers. Developing this helps with the rankings on Google, so that people can search keywords and your practice naturally pops up higher on the search engine. Statistics show that 84% of people do not click past the first page of search. And of those, about 50% do not even scroll down past what's on the screen. Setting up a YouTube channel is easy and highly recommended. Here's some ideas I have put together that you can develop with your YouTube page. We have developed an obstetrical orientation for all of our new obstetrical patients to watch. Many of the questions that they have are answered by watching this video. I only caution you to limit your videos to about 2 minutes. The attention span beyond that is very, very low. Google is a powerhouse. The more you do with Google, the better. By registering your location through Google Places, you will show up on Google Maps. Make sure you update if you relocate your office. Once you set up an account, you go through the verification process, and voila, you have been put on the map. You can add your office hours, link to your website, put videos and photos, and they even have many statistical information that you can analyze to see who is visiting your listing. Google Analytics is another important online tool that is free and shows What pages on your website are viewed most, and by what type of device, such as a smartphone or PC, Android or Apple. Keep your content fresh and memorable. Be light and fun. Don't get too technical. Unexpectedness can also include surprise sales, and special contests and quizzes. Delight and reward your audience. Be careful of opinions. Everyone is focused on the election and politics right now. Try not to get caught up in the middle of these, as you will be alienated by several groups of patients. But be real. Patients want to connect with others that they can bond and relate to. Share stories about your physicians and give your audience an opportunity to build relationships. Once patients log into our patient portal, they have quick and easy access to many features that they need and want. How developed have you made yours? Do the colors match your office colors? Is the navigation easy? Do you have buttons big that help drive patient behavior online? Have you set up online bill pay? Can your patients see the statements online? How easy is it for them to understand them? Can I submit detailed clinical messages or just a note box that all patients use to describe every problem? These are just some of the navigational and design recommendations for your patient portal. Here are a few more that I have put together on a checklist for you. Make it mobile friendly. Over 25% of our patients use smartphones to access our office portal. This shows a snapshot of the phone call volume we have in our office every day. We use a call center environment which consists of many clerical staff that talk on the phone all day. They are scheduling appointments, documenting patient medical problems for the nurses that are then forwarded to the triage team. The volume of calls is overwhelming and often causes frustration to patients and staff. Currently, we have 3 nurses handling all clinical matters. Over half the time is spent on calls is wasted in unnecessary communication. Find ways to reduce the staff time and costs. But patients are smart and they try to get free care over the phone. You are doing them a disservice, as it is many times difficult to diagnose patients and can take several calls to resolve an issue, going back and forth with a physician, asking questions, etc. We encourage our nurses to offer patients appointments and address their problems with the provider. The telephone remains to be one of the greatest tools in our office. It is the gatekeeper most widely used today. Hopefully, this will shift over time to going online. However, how sophisticated is your system? What features does it offer? We have a nurse that moved due to her husband's job transfer. We gave her a voice-over IP phone and is helping with many tasks several states away, but as if she is working down the hall. Do you have messages you can have patients listen to while they are on hold? Or is it tied to a radio station? This is a great opportunity to announce important information about your practice. How often do you change them out? We work with a vendor that records scripts that we develop 6 times a year. What reports can you get from your system? How long are your calls taking to wrap up? One of the best features we got with our current phone system is the ability to record phone calls. This has been extremely helpful and used frequently. You will want to decide how best to develop your phone mapping for your auto attendant. Most people accept this as the norm today. Do you want to set up a call center environment to answer all the calls for all your doctors in all office locations? Or is it better for you to be decentralized? Make sure you set the expectations of your staff on time to be on the calls as well as to return voicemails. Like I said earlier, my expectation is that voicemails must be returned within 6 hours. Definitely review these details annually as things always change or just need to be tweaked. Marketing is a two-way street. Sending out communication is only half the equation. Listening is just as important. Listen for customer service opportunities. Listen to what people are praising and criticizing. Gather intel on your competitors' reputations. Use social media in a crisis situation by getting ahead of rumors or confusion. It is an invaluable tool if you stay engaged. The key is not to post and abandon. Just a couple of days ago, our entire 9-story building was evacuated for a couple of hours due to a fire alarm going off and smoke smell in the building. Firemen were coming through the building, kicking people out. We had little time to lock the doors, put signs up throughout the office, and we weren't able to even put our phones on night greeting. We quickly posted on our Facebook page to let patients know what was happening. Constant Contact is a one-stop shop that we use in our office. E-blasts, RSVPs to events, satisfaction surveys, and a ton of tools in that toolbox. It is fairly inexpensive and user-friendly. The reporting on the backside is fantastic. We don't even have to rely on a third party for customizations. We can do it ourselves. Social media has made online reviews easy. There are many review websites for physicians, and a lot of them allow the person to be anonymous. With HIPAA, it is difficult to protect your reputation. However, I have learned that being perfect, or 5 stars out of 5, gives the appearance that your scoring is inflated and not real. Having an average of 1 star out of 5 is not good either. So being up high is where you want to be. Facebook pages allow fans to write reviews. I actually encourage patients to write reviews through Facebook, Google, and even Yelp. We do monitor these and address them if there is something important to review and improve. We may talk to the patient offline, but we don't want to come across as a stalker. So it is a fine line to walk. Other review sites you should go to and update your information includes Vitals, RateMD, HealthGrades, and ZocDoc. Just Google physician rating websites and you will quickly see several to manage the content like phone, address, website, etc. We also send out satisfaction survey to patients within 48 hours after their appointment and review these monthly in our customer service committee. I used to be disappointed about bad comments, but recently I have changed my tune and welcome them. If one person complains about something, there are over 100 more that may feel the same way but don't communicate. I want to know what I need to improve. We are not perfect and can always work to be better. Training employees on social media office policy from day one is critical. Make sure you have a policy in your handbook that addresses these issues. There was a heated discussion about circumcisions in a negative light, and it made it look bad for our physicians that do them. We had to quickly address this with the employee. She was a nurse involved in an office circ and said how torturous it was for that little boy, and it just snowballed from there. Measurable outcomes with all your marketing efforts is critical to demonstrating the value of the cost and time allocated to marketing. Define how you are going to measure each aspect at the beginning and set dates to evaluate performance. Some of the results we identified with our marketing efforts is an increase in same-day appointments after a campaign, a shift from incoming phone calls to increased portal utilization and self-service actions. We also track OB patients transferring in and out of our practice from other practices. We want to know why they are coming or why they are leaving. One more area that I'll talk about in a minute is the help desk. Telephone systems are very limited on what data you can pull. You can see the time someone spends on a call, but you can't automate a process to know why they are calling or if there is a specific clinical commonality. Our call center takes a beating with the amount of calls that they are handling, from appointments to clinical problems. We chose not to have a voicemail box for nurses and felt it was better to have a clerical person document the call and route to the triage nurse. The problem is that the clerical staff change frequently and the learning curve is huge. We had a written protocol for all of our clinical problems, but it wasn't standardized across the group and the documentation was limited. We discovered Kiona a couple years back as a solution we had been longing for to help with this issue. Rolling forward, our call center uses Kiona for all clinical related calls, and the nurses and doctors love this, as it makes the process more efficient and well documented. We encourage patients to also use Kiona inside our portal and totally bypass the clerical staff and avoid long wait times to get through to someone on the phone. They can use any device to access and are rewarded with quicker response directly from a clinical staff. We still have more patient education to accomplish this, but has vastly improved patient satisfaction. We can even track the type of clinical issues by protocol and prioritizing the issues and address urgent issues more quickly than just trying to sift through a pile of phone notes documented by the call center staff. We have better documentation and standardized procedure in addressing the clinical problems. I would encourage each of you to soak in all the benefits available this software offers, as I could spend an hour just talking about it alone. There will always be pessimists that complain about everything changing or new. And my hope is that you can work with these individuals and show them the vision of what could be or how it will be better. Yes, many companies stay off social media or disable their audience's ability to respond because these companies are afraid of negativity, but they are also blocking positivity. It is the man in the arena, a quote from Eleanor's brother-in-law, Teddy Roosevelt, who deserves admiration and has the opportunity to achieve greatness. And with that, I will close my presentation and turn things back over to Stephen.
Wow. Thank you so much, Bill, for that absolute wealth of information. There is so much there that I absolutely loved. The value portfolio, I mean, my goodness, sitting down with your leaders to outline your distinct value of the practice. And I kind of wonder, you know, for those who are listening, if they were to ask a random physician in their practice what the top values of their practice were, you know, how many would be able to give an answer? And yet how critical those are for your entire patient communication. So I want to reiterate a couple things that Bill mentioned throughout. One is he's got a huge number of checklists here. And not only will we be sending out this presentation to everyone later, but we also will have a download of tips, checklists, and suggestions that Bill has provided through this webinar, so that this can become a type of checklist and go-to for helping you walk through. Now, you can click your questions. We're about to go to a live Q&A time. You can click the Q&A box on top of the webinar bar and just type in your questions. And please get started doing that, and we will address these questions in just a few minutes. In the meantime, I have just a couple announcements. One is an announcement that is unique to everyone who is participating in this webinar. Kiona Health is offering free iPads for practices that sign up within the next 60 days. If you signed up to this webinar, we have your organization name, we have your email address, and simply go onto kionahealth.com, click the requested demo, or just give us a call. And if you evaluate Health Desk and feel that it is right for your practice, we'll throw in some free iPads for you. Also, I want to announce our next webinar. It is going to be held on August 30th, and it's going to be talking about staffing for smaller practices. Terry Rollo, who is nurse manager of Northern Virginia Pediatric Association, is going to be talking about the lessons that they've learned and the improvements, terrific improvements they've been able to make in their telephone workflow, even though they are a really small pediatric practice. You can sign up for this by going to kionahealth.com/September 2016 webinar. And there will also be signups for this webinar in the follow-up email that you will be getting tomorrow. And with that, we will open the floor up to your questions. So here we go, Bill. So we like a lot of what you have to say. You mentioned a bit about getting your entire staff involved. How do you involve physicians and get them to commit to this process?
The physicians are directly connected with the patients, and the patients typically listen to what their doctors are telling them to do. And if you can demonstrate to your physicians the value in offering this marketing, whether it's the patient portal or other kind of a tool, it helps demonstrate the value in reducing costs and patient satisfaction. In today's world, we have to listen to our patients and determine what it is that we're not doing correctly or best. And the physicians need to understand that this is an important part of their practice. More than just practicing medicine, they have to also be satisfying their patients. And so I think it's an easy sell when you look at it from that lens, is that, you know, the physicians have a direct benefit from the marketing efforts and offering tools to your patients to communicate with you back and forth.
Interesting. Now, do you have a particular physician or two that are champions in your practice?
I do. I feel like I've got an epcot of physicians that range in ages and technology uses. I've got some that get the latest and greatest iPhone as soon as it gets on the market, and some that are just opposed to anything technology. There is one physician that we have the fortune of having as a medical director who works in an administrative capacity, and I encourage any practice to work as a dyad with a physician partner to work on a lot of communication pieces to patients. I am not a clinician, have not gone to school to understand medical information. And so having that person help triage what topics and how to even write what is a good post on a newsletter or blog or Facebook post is really key to helping with that. And then they can also be an advocate to the rest of the physicians to get them on board as well.
Great, very good, fantastic. Okay, so here we go from Josh. I like your suggestions, but this is a lot of work that you've laid out here. Were you able to get started on this before you hired someone to do this, or did you have to hire someone to go through this?
There was no budget initially to do this program, and so I had to do it myself or pick one or two of my staff that I could trust to do things in the office on a very shoestring budget. So, doing a Facebook page might be the first thing that you want to do. And that's pretty easy to set up, and you just need to identify, maybe on Mondays you're going to post a topic for one area. Maybe like for our office, it might be a gynecology topic, or on Wednesday, it might be something obstetrical. There might be something in the news that might pop up. And so that's just a good starting point. Certainly, if your budget allows and permits to have somebody on staff, that's fantastic. We have gotten large over time, and with that, we have developed an in-house public relations person. I worked with the local university. There were College of Business or marketing students that were looking for projects to do, so you can utilize them at no cost to get off the ground. But over time, we just saw the value of this, that we put in our budget for a part-time person and evolved now into a full-time person.
Oh, wow. Yeah. Oh, that's a pretty good story. That's great. So you talked about centralized versus distributed. It's kind of clear in your presentation that you use centralized. How did you determine the centralized versus distributed?
Very simply, we have one office location and we want to have one standardized process for everything. And, back when we first had the group get together about 20 years ago, they each had their own staff and they were answering the phone calls for that physician. And if that person is out or on vacation or they're sick or having to cover somebody, then they're not doing their job that they need to do for that physician. And so it was quickly apparent to us that working as a group to handle the masses was going to be most efficient for our office. Those individuals in the call center have many tasks that they handle, so they're not just sitting there waiting for the phone to ring. They're also, working on waiting lists, looking at canceled or no-show appointments just to make sure we do charge, for no-shows. We do warn patients ahead of time for that, so there's another job for them. All the referrals in from the community physicians, they are also working on that, eligibility and verification. So I created a work environment for them to do more than just one task, and it actually has helped us in having a group, a centralized environment for our office needs.
Oh, that's fantastic. So they're able to facilitate some of the other tasks that need to be done in the office anyway. So it's not like a full FTE just only for the phones. It spreads over to other categories.
That's right. And, they are the funnel for all the inbound communication from patients. So whether the patient's just calling to schedule an appointment or they need a prescription refill or they want a lab result, that group is handling the influx of phone calls. So by having a centralized group, they can help each other and hopefully minimize the amount of time person is waiting to get through to a live person.
Okay, great. Yeah, fantastic. And helping the patient satisfaction. So if there are any other questions out there, please post them. I'm not seeing any others. I'll give you just a few more seconds to post any additional questions. And we'll answer them. Well, none are coming in right now. So if you have any other questions, here's what I'd suggest. Feel free to reach out to me, and Bill has made his email address available for any follow-on questions about any of these issues related to the strategy or implementation of your patient communications. Oh, actually, we do have a question right here, another one. How long, did it take your staff to learn a new workflow? About
60 days to go from the very beginning. You have to identify what the outline is, the process that you want to develop from the very beginning, and then you work through this. And I strongly suggest, I don't have all the answers, and incorporating those key employees that work in the trenches, that deal with this every day, that you include them in the process. And there's things that I've learned just from them that I wasn't aware of that helped make a process more successful. But there is a process for everything that we do change in the office, and I don't want to cram too much change at once. So for the Kiona, this is more of a recent project that we did. We first went through the process to set up all the technical interfacing between our EMR and the Kiona system, and then tested that, make sure everything was working correctly. Then we had Kiona come do training for our super users, let them get familiar with the process, and so that they can train the rest of the end users in the office. And over the course of time, I think it was about 60 days that we used to do that. And we still didn't even market this to the patients. We started with doing more in-house process only, and we focus on our obstetrical patients because they're the ones that kind of have more routine questions throughout their pregnancy. And then if everything looked good, then we rolled it into our gynecology practice. And then once all that was done, we had promoted this out to our patients. We even did a contest for people to actually use the product for a $100 Visa gift card. And so we had a great response from patients just to introduce this new technology to them. And everything, every project that you do, whether it's Kiona or some kind of patient portal in general, you're going to have some hurdles to get through, and you just have to make sure you have consistent feedback and a process to improve the process.
Yeah, I will add on to that. There are a couple unique things with North Florida. One is that, as you could probably tell from this webinar, Bill was pretty keen on the marketing, getting the training set up first and then doing the marketing. That's fantastic and absolutely critical if you're going to be implementing the online piece. And we look forward for the rest of you to seeing you on next month's webinar. Thank you very much, and we'll be following up tomorrow.